Alrighty, Mike warned you. Everybody stand up. You gotta move. We've been sitting for way too long, right? So stand up, roll your shoulders back, give yourself a little bit of room. Just stretch your arms open wide. If you know the person next to you, give them a little tap, love tap. And reach them up high. And just side to side, just really fluid movements, back and forth. Feel how your body is. Be mindful as you do this. There you go. And take it down, just roll it out. You can just lift your legs a couple times. Everybody feel the blood flowing a little bit now? Hi, Alan Hobson. Hello. Alrighty, you can sit back down. And then you can stand up one more time. Up, 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 up. Come on. There you go. That is exercise. Okay, now you can really sit down. Maybe. No. If you want to stand up for the rest, stand up. Just go around to the edges. I always say this, and Mike has heard this before, these talks would be best if we had little headphones on and we were out walking somewhere together, right? Because sitting is what we want to try to do less of. So you've heard tonight what I call your compendium, really, of wellness resources, right? We need to get better sleep. We need to reduce our stress by being mindful or doing something else. We need to eat well. And then your fourth big one, we need to move more. So we are in Canmore, as Mike said, and I'm probably speaking to the converted. Hands up if you get some sort of physical activity daily. Pretty much. Okay, how many people get exercise daily? If you know the difference, we're going to talk about this. How many people move daily? Okay, so this is important because we always talk about exercise, and there's this big movement called exercise is medicine. Has anybody heard of this? Yeah? Okay, so really and truly, no offense to anybody behind me, but exercise is probably one of the very best things that we should be doing for our health and well-being, and even more so when we're trying to manage a chronic disease like cancer. Okay, so it really is the best medicine. If we could put exercise into a pill, we'd be all good. It would be golden. But we can't. And it's a behavior that is more complicated than many of the other things that we should do that's good for us, like brushing our teeth. So oftentimes we'll hear this analogy, like you've got to make exercise a habit. It should be like brushing your teeth. And that is true on many levels. The difference, brushing our teeth takes 30 seconds to 1 minute. And yes, there's some high interval intensity training exercise literature that's out there saying, really, you only need to get about a minute a day of exercise. Debatable, right? Exercise takes a little bit more than brushing our teeth. So yes, we need to think about it as a habit, but we need to build up to it in most cases. And when someone has cancer and you're sick and you're tired and you're exhausted and you're emotionally drained, the thought of engaging in exercise can be really tough to take. And if you've come into your cancer journey and you haven't been active to begin with, really hard for somebody to go, okay, I'm going to all of a sudden start exercising 30 minutes a day. Okay, so the first thing I want to just kind of get into our knowledge is, what do we mean when we talk about exercise versus physical activity versus moving more? And if there's one thing I want you to take away from tonight, or to tell a friend or to tell somebody you know who's going through cancer, is the take-home message is really move more. Okay, you don't have to be fancy and go to a gym. Okay, you don't have to have weights or machines or a sport that you're doing. You just want to move more. And it can be as simple as standing up while you're talking to somebody. Okay, it can be doing active commercial breaks if you like to watch the hockey playoffs that are on, even though Calgary's out and that really sucks. Okay, but if you're cheering for Edmonton or anybody else, right, you may want to watch those games. Can you be active during the commercials or even during the game? Okay, the rule in my house, I have 3 children and a husband, just one. And our goal is that we have yoga mats in front of our TV and we've got some exercise mats on the floor. So if we are watching TV and the hockey's on pretty much throughout the playoffs, we've got the floor to go onto, right? So we can do some core work, we can do some stretches. You can do it in your chair right now while you're listening to me. You can extend one leg at a time and then do the other leg, okay? This is what I'm talking about when I talk about moving more. Okay, so that's our first message. Second message is that we all engage in physical activity at some level if you're mobile. If you're moving, that is physical activity. So it is all the movement you get during a day. Exercise is the more structured activity that you're purposefully engaging in to improve your health. So if you go into the cancer center, or if you come to our talks, or if your doctor's really on the ball, they may prescribe exercise. Does anybody know what our current guidelines are for exercise for the general population? How much should you be getting? A little bit more. 30 minutes most days of the week. of aerobic activity. So aerobic activities, you're walking, you're cycling, you're swimming, anything where your heart's going, you're breathing harder. Okay, what else is part of our exercise guidelines? Anybody know? What else should you be doing? Stretching. Okay, stretching daily. So our guidelines are you should be engaging in stretching daily. Okay, and what about this kind of thing? Strength training, okay? If we do squats, if we do arms, okay? You should be getting resistance training at least 2 days a week. So our exercise guidelines are all those things. It's not just the walking, the aerobic that most of us say 30 minutes most days of the week, right? Your goal, the exercise guidelines are 150 minutes of aerobic activity weekly, plus at least 2 days of resistance training, plus flexibility, stretching most days of the week. Okay, so that's all of that. And resistance training can be using your own muscles, adding in soup cans, adding in those stretchy bands, using fancy machines. All of that counts. Yoga. Well, yoga covers a few different categories. It can have the aerobic, it can have the strength, and it's flexibility training, right? We'll talk about yoga in a minute because if you do nothing else, do yoga. That's my other take-home message. Okay, so that's exercise. So you're a 65-year-old recently diagnosed with colorectal cancer. You've been fairly sedentary. Your doctor says, okay, exercise is good for you. Here are the guidelines. Go start getting 30 minutes of aerobic a week or a day and resistance training and stretch. What do you think that cancer survivor thinks? They're sick. They're on chemo. They're sick. Yeah, ow, and over, yeah, really? I don't think so, right? That's what they're thinking. Right? So our messaging has to change to how active are you? Do you move during your day? Can we figure out where you can just move more? Can you walk a little bit more during your day? Okay, when we give our guidelines out, that's great, but those are our optimal guidelines. Guess what? Less than 50% of healthy Canadians are reaching those guidelines. The guidelines for cancer survivors are exact same as they are for everybody. Okay, so there's no difference in what we recommend for cancer survivors to get. Okay, and the health guidelines are there, those exercise guidelines are there because they do help us achieve optimal health. So we know if you are that active, it does reduce your risk of cancer. There's research that has come out that's shown really if you have had cancer, if you're active at around 90 to 120 minutes, so not even reaching those guidelines, you reduce your risk of recurrence. Okay, so there's benefits to doing it after. Okay, and there's immediate health benefits for you in terms of your quality of life, in terms of your energy levels, in terms of your emotional well-being. We know we get all of those benefits from that. Okay, but by just telling people that's where they have to be, lots of people aren't there. In the cancer survivor population, approximately 18 to maybe 22% are active enough to achieve those guidelines. Okay, so most cancer survivors are not being active enough. Okay, and so I think we need to start talking about just how active are you and can you move more? And that should be one of our key take-home messages. So as Mike said at the beginning, I'm interested in this, all the evidence, and we do a lot of research in my lab and with collaborators around the world. But what I'm really interested in is what are the cancer survivors going to access? Because I can guarantee you most of the cancer survivors aren't reading what I publish. Right? And I loved that Lisa Ednight's cabin is going to be about that translation. It's called knowledge translation. How do we take this best evidence and give it to the people who actually use it? Right? And so really that's what I focused on my lab in Calgary, about building evidence-based community programs for cancer survivors to help them become more active, to help them lead lives that have more wellness in them. Because our healthcare system is great at treating disease, isn't really focused on then where's the wellness piece in that. So my kind of second big take-home message after move more is start advocating. If you're in the cancer system as a cancer survivor or as a support person, start asking and demanding for where are the wellness resources that we should be getting. And it's all the 4 behaviors you've heard here tonight. And that's really how we start to see change build and the demand when it comes from the patients, from the families, that can help us really make the change that we want to see as researchers in this field. And so in my area, we focused on building wellness resources and exercise programs in particular for cancer survivors. So at the back of the room, I've brought in a couple of our resources. The ACE program, and this is a provincial program, the Alberta Cancer Exercise Program. It started just this January, so this is brand new. This is funded for the next 5 years. And really our goal is not to offer one-off programs here or there. It's to make exercise part of standard medical care. So it really is about exercise as medicine and should be part of the cancer journey. And so this is in Edmonton and Calgary. It is moving to all of our communities outside of our 2 major cancer centers over the next 5 years, starting this spring. So we're in Red Deer, Medicine Hat, Lethbridge, Grand Prairie. That's our first round already starting to happen. Okay, and then from there we'll build it out, and it's really going to be built out based on demand. If we have a population who wants the program, we will offer the training to fitness partners in the community, and they will run the program. Okay, so that's the ACE program, and there's a pamphlet in the back. I've also brought a pamphlet about our lab because this is our big program right now, but we've got a number of programs, and most of these are Calgary based, so unless you're coming in regularly to Calgary, maybe not that useful. But I just want to give you an idea of kind of the program that we're doing, and it's really built around behavior change. So there are some elements of the exercise programs based on the evidence that we know we want to do differently depending on the tumor type. Right? So for breast cancer survivors, we have a different looking program than for head and neck cancer survivors, and we have a different looking program for prostate cancer survivors as examples. And we have a kids program as well, and they all look slightly different, but exercise is exercise, right? So if I'm teaching you a squat and you a squat, it's still a squat. Okay, but some of the other pieces that are different are around the behavior change. So most of us, if we have a program set up for us and we're going to a class that's designed for us, we'll do that. And then after it all ends, we stop doing it, right? So adherence to this lifestyle behavior for wellness isn't really very good. And so part of our model is we've designed a 12-week model. So all of our programs in ACE and the other programs we have are all 12-week models, and then 12 weeks of maintenance, because behavior change doesn't happen quickly, okay? And really cementing that change. And then within these exercise programs, we teach you the skills that are necessary to help you to keep going. Things like goal setting. Things like recognizing what's stopping you from being active right now, right? So all of us know exercise is good for us, and lots of us, for whatever reason, don't fit it in every day, right? And lots of times we say we're too busy, we don't have enough time, we're too tired, right? These are all reasons that we give. And so we try to teach cancer survivors, okay, well, it's not about going to a gym for 30 minutes. It doesn't have to look like that. Where can you, when you're in the cancer center, actually exercise? Okay, can you get some walks in while you're here? What can you do in the chair in the waiting room? Right, we've just devised and put together a series of waiting room exercise videos, so when patients are sitting there, they can see these in the waiting rooms and do simple movements in their chair. Right, so there's ways that we can help you work with the barriers so that you can make it something that becomes part of your lifestyle. Okay, we do other self-regulatory skills, like how do we harness the power of social support. Okay, all of the programs that we offer are group-based. We don't do anything really at an individual level unless it's really necessitated by the demands of the person and their unique needs. We know that the number one predictor of someone, if they're going to continue to exercise down the road, is if they have support to do it. Okay, and it can come in many domains. So if you have a dog, you're more active. That's a form of social support. You've got to get that dog out. Okay, people that have a group to go to, that have a partner to walk with, that have a supportive spouse at home who says, I know you need to get 15 more minutes, so I'll do the dishes. Right? All of that helps. And I saw the nudge. I try that with my husband all the time. It doesn't always work, but sometimes. Okay? So all of those things we know will help that individual get in their daily activity, will keep them moving. Right? So social support is absolutely central to this. One of the biggest sources of support during the cancer journey is the healthcare professional. And so a lot of the work that we're doing within ACE and our other programs is harnessing really the power of that healthcare professional to advocate for exercise as part of the cancer journey. So I've just brought an example so you can see what I'm talking about, but how many of you have ever had a prescription for exercise from your healthcare provider? One. That's one more than I've ever seen in an audience when I've asked that question. That's awesome. That's what we're starting to do. So in part of making our exercise as part of standard care, we've devised these very simple, it's not rocket science here, prescription pads, so that physicians can put somebody's name in, check off, and then that person is responsible for connecting with us. Okay, that's our first step. That's not where we want to be. We want it to be that we connect with them because we're in the system. We have exercise professionals part of the cancer care team. And so as soon as someone's diagnosed, they'll get a prescription for a baseline fitness evaluation and then prescribed what they need to get started. That's where we need to be. And that's where we're working for. But for right now, this is a pretty good start. So we're using these within ACE. This is our ACE prescription pad. We also have a large program across Canada specific to men with prostate cancer. So if you have someone in your life or you have prostate cancer, you can speak with me after or ask a question, but this is a program that's available across Canada. We've got over 30 sites running this program, and we've got it online. So that helps with all those smaller towns where there isn't a program. They can access all the information online. And we've got urologists and radiation oncologists using these prescription pads so that men can find out about this. It's called True North Lifestyle Management Resource Program. Okay, so these are some of the pieces that we're trying to build to really move exercise as that, oh, extra, maybe I'll do it. I know it's good for me. I'll try to fit it in, into this is part of your standard cancer treatment. This is a piece of what you need to learn as you go through the journey that will really help with your outcomes. Because the evidence is all there, and I think anybody sitting in this room, everybody's hands went up. The groups at the beginning, there was walking, hiking, skiing. Everybody mentioned something active they had in common, right? We all know what's good for us, right? And when you're dealing with a chronic disease, there's benefits above and beyond. Okay, so that's not in question. Now it's just the how do we build it so people can access it, so we can remove the barriers, things like cost, right? So all of the programs that are in our lab resource that are in ACE, they're all cost-free. They're all funded by programs. So our goal is to get the healthcare system now to start thinking about funding exercise as part of that treatment journey and going through to enhance people through to survivorship. Am I about done? I'm good. Alrighty, I'm going to end with that, and then I'm happy, along with everybody else up here, to start entertaining questions if you have them. Thanks.